Whether you are trying to space your children, avoid pregnancy for now, or you just want to understand your body better, this video is definitely for you. We are going deep today, I mean really deep, into the different types of family planning methods, starting from natural methods all the way to permanent and emergency options. We'll break it all down in a simple, relatable way, including how each method works, the advantages, the disadvantages, and how to choose what is best for you. Hi beautiful people, welcome back to my channel. My name is Esther. I'm a nurse with a passion for educating and empowering people to make informed healthcare decisions, informed choices. Today we are diving into an essential topic, which is family planning. Yes, family planning isn't just about preventing pregnancy, it's about having control over when and how you want to start to grow your family. Whether you are looking for natural methods, medical interventions, or permanent solution, this video will break down all available options. If you are someone who loves learning, believes in making informed decisions, or you are just curious or making informed choices about how these things works, please don't forget to subscribe to this channel. Give this video a thumbs up and share it with someone you love. Trust me, you don't want to miss what is coming. And to my returning subscriber, you guys are the real MVP. Thank you so much for always supporting me. Before we dive into the different methods of family planning, let's first understand why it is so important. Family planning isn't just about preventing pregnancy. It has a deep impact on health, finances, relationships, and even the economy. When individuals and couples have the ability to plan when and how many children to have, they can create better lives for themselves, their children, and their communities. Let's explore some of the key reasons why family planning is crucial. It helps prevent high-risk pregnancies. Unplanned pregnancy, especially women with pre-existing medical conditions, can lead to health complications. Family planning allows couples to space pregnancies, reducing risk of maternal and infant mortality. Also, it helps improve maternal and child health. Women who space their pregnancies at least 18 to 24 months apart have healthier pregnancies, reducing complications like premature birth and low birth weight. Also, it helps prevent sexually transmitted infection. Certain family planning methods like condoms, they do not only prevent pregnancy but also reduce the spread of STIs, including HIV/AIDS. Also, let's talk about the economic stability and inflation. It helps improve financial planning and stability. Raising children requires financial readiness, yes. From diapers to education, the cost of raising a child is very high. I'm telling you, family planning helps couples prepare financially, ensuring that they can provide for their children without struggling. Yes. Also, it helps reduce impact of inflation on families. With inflation, the cost of living is rising, food, housing, healthcare, and education expenses are all increasing. Family planning allows parents to have children when they are financially stable and helping them to avoid unnecessary economic strain. Yes, it also reduces economic burden on government. Family planning helps reduce economic burden on government. When families have fewer unplanned pregnancy, there's less pressure on healthcare systems, education, and social services. Government can then allocate resources more effectively, improving the overall economy. Also, it helps empower women economically. Family planning enables women to pursue their education and careers, contributing to the economy and improving financial independence. Yes, you can't be carrying pregnancy all the time. Now, let's talk about how it helps family. It helps build a stronger family relationship. Planning pregnancies allow parents to focus on raising their children with love, care, and attention, strengthening family bonds. It also helps our mental and emotional well-being. Unplanned pregnancies can lead to stress, anxiety, and even postpartum depression. Family planning provides peace of mind and control over reproductive choices. Yes. Now that we understand why family planning is important, let's talk about the different types available. Family planning methods are divided into two main categories: the natural method and the artificial methods, or the medical methods. Each method works differently and has varying levels of effectiveness. The choice of method depends on individual preferences, religious beliefs, health conditions, and lifestyle. So the natural family method. These methods rely on a woman's natural fertility cycle, self-awareness, and timing. It doesn't involve any hormones or medical interventions. It doesn't involve any of this. This includes the fertility awareness-based method, the withdrawal method, lactation amenorrhea method, yes. And also, we have the barrier method. This physically prevents sperm from reaching the egg. The male and female condoms fall into this category, and the diaphragm and cervical caps. Also, the hormonal methods. This alter a woman's hormonal cycle to prevent ovulation or implantation. This include the birth control pills, contraceptive patches and injections, and we also have the intrauterine devices as well, IUD. This involves long-term method placed inside the uterus, the non-hormonal and the hormonal IUDs. And we also have the permanent methods for individuals or couples who no longer want children. This includes tubal ligation, the female sterilization, and vasectomy, which is the male sterilization. Also, we have the emergency contraception, which is used to prevent pregnancy after unprotected sex. Let's go through each method in detail. Natural family planning involves monitoring fertility signs to determine when a woman is most and least likely to get pregnant. It does not involve hormones, drugs, or surgical procedures, making it a preferred choice for those who want a natural approach. Natural family planning requires commitment. Yes, it requires commitment, patience, and careful tracking of bodily changes. The commitment and patience cannot be overemphasized. Let's go through each method in detail. The fertility awareness-based methods. This method involved calendar method. One of it involved calendar method. This method involves tracking the menstrual cycle for several months to identify fertile days. It works best for women with regular cycles. We also have the basal body temperature method. A woman's body temperature slightly increases after ovulation. By measuring it every morning before getting out of bed, the woman can identify a safe and fertile days. Also, we have the cervical mucus method. Cervical mucus changes in consistency throughout the cycle. So before ovulation, it becomes clear and stretchy, resembling egg whites. So this indicates high fertility. We also have the symptothermal method. This combines the basal body temperature and cervical mucus tracking and cycle calculations, making it more effective because it is combining all the three. What are the advantages of natural family planning methods? No side effects, cost-free or low cost, and can be used to achieve or prevent pregnancies. And it also encourages communication between partners. The disadvantages is that it requires daily monitoring and discipline. It requires commitment. It requires patience. It is less effective if it is not done correctly and does not protect against STIs. Let's talk about barrier methods. Barrier methods works by physically preventing sperm from reaching the egg, reducing the chances of fertilization. These methods are widely used because they provide immediate contraception and in some cases protect against sexually transmitted infections. They are non-hormonal, making them a great option as well for individuals who prefer contraception without side effects. Now let's talk about types of barrier methods. These include male and female condoms and the diaphragm and cervical cap. Male condom is a thin latex or polyurethane sheet which is worn over the penis during intercourse, while the female condom is a pouch inserted into the vagina before sex. How do they work? Both condoms act as a barrier, preventing sperm from entering the vagina and reaching the egg. That is how they work. Advantages is that it protects against pregnancy and STI, it is easily accessible and affordable, and there's no hormonal side effects as well. Disadvantages is that it must be used correctly every time. There's risk of breakage or slippage, and some people are also allergic to latex. Let's talk about diaphragm and cervical cap. Diaphragm is a soft, flexible cup placed over the cervix before intercourse. Cervical cap is a smaller version of the diaphragm that fits snugly over the cervix. How do they work? These barriers block sperm from entering the uterus. They must be used with spermicide to increase effectiveness. The advantages include that it is reusable and hormone-free as well, and can be inserted hours before sex. The disadvantages is that it requires a prescription and fitting, and it is less effective than condoms if it is not used properly, and there is no STI protection. Now, let's talk about hormonal contraceptives. Hormonal contraceptives work by altering a woman's natural hormones to prevent pregnancy. They do this by stopping ovulation, thickening cervical mucus to block sperm, or thinning the uterine lining to prevent implantation. These methods are highly effective but come with potential side effects due to hormonal changes in the body. Let's talk about the types of hormonal contraceptives. We have the birth control pill. These pills are taken daily, and these pills contain estrogen or progestin to prevent ovulation. The advantages is that it is 99% effective when taken correctly, regulates menstrual cycles, reduces acne and period pain. The disadvantages is that it must be taken daily at the same time, and it can cause nausea, weight gain and mood swings, and there's no protection against STI. Now let's talk about the contraceptive patch and vaginal ring. The patch is placed on the skin and delivers hormones gradually. The ring is inserted into the vagina and releases hormones over 3 weeks. The advantages is that it only needs changing weekly or monthly, and there's less daily maintenance than the pills because the pills are taken daily and this one is weekly or monthly. The disadvantages is that it may cause irritation or spotting, and there's no STI protection as well. Let's talk about the injectable contraceptives. How do they work? It is a hormone injection which is given every 3 months. The advantages is that it is long lasting and highly effective. No daily pill required. The disadvantages is that irregular periods or prolonged bleeding and can cause weight gain also, and there's no STI protection. Now let's talk about IUD, intrauterine device. An intrauterine device is a small T-shaped device inserted into the uterus by healthcare provider. It provides a long-term contraception, and it is one of the most effective birth control methods available. IUD comes in 2 types, hormonal and non-hormonal, which is the copper IUD. Let's talk about the copper IUD, which is the non-hormonal. How do they work? The copper in the IUD creates an environment that is toxic to sperm, preventing fertilization. The advantages is that it can last up to 10 years. It is non-hormonal, so there's no effect on menstrual cycle. Disadvantages is that it can cause heavier periods and cramping. It requires insertion and removal by an healthcare professional. Now let's talk about the hormonal IUD. How do they work? This one releases small amounts of progestin to prevent pregnancy. The advantages is that it can last up to 3 to 7 years, and it also reduces menstrual cramps and flow. The disadvantages is that it may cause spotting for the first few months, and it also requires an insertion by an healthcare professional. Now let's talk about permanent contraception. What is permanent birth control, permanent contraception? Permanent contraception is for individuals or couples who no longer wish to have children. These methods are highly effective but irreversible. The first one we'll be talking about is the tubal ligation, which is also known as the female sterilization. How does it work? The fallopian tubes are cut and tied or sealed to prevent sperm from reaching the egg. The advantages is that it is permanent and highly effective. The disadvantages is that it requires surgery and cannot be reversed. Now let's talk about vasectomy, which is also known as the male sterilization. The vas deferens, which is the sperm carrying tubes, are cut to prevent sperm from being released during ejaculation. The advantages is that it is a quick and simple procedure compared to tubal ligation, and it is highly effective as well. Disadvantages is that it requires surgery, not effective immediately. It takes weeks for sperm to clear. Now let's talk about emergency contraception. Emergency contraception. What is emergency contraception? Emergency contraception is used to prevent pregnancy after unprotected sex. It is not a regular birth control method but can be a backup option. This includes morning after pill. How does it work? It prevents ovulation if taken within 72 hours. The advantages is that it is available over the counter and it works quickly. The disadvantages is that it is less effective the longer you wait, and it can cause nausea. Also, copper IUD as emergency contraception. If inserted within 5 days after unprotected sex, it prevents implantation. Advantages is that it is the most effective emergency method and can be used for long-term birth control afterwards. The disadvantages is that it requires a doctor's visit. It requires you to go to the hospital. It is not something you can do by yourself. Now, we've covered all major family planning methods, the advantages and disadvantages. The best method depends on individual needs and your lifestyle. If you have questions, please drop them in the comments, and don't forget to like, subscribe, and share this video. Thank you for watching, and I'll see you in my next video. Bye. Watch my video.